In 2020, the big question is which Medicare supplement is the best? So if we haven't met yet, I'm Matea Yoakum with Ignite Insurance Group, and I am here to help explain to you the different letters involved in Medicare supplements, the different coverages, and which one may be considered the best here in the year of 2020. So with all of the letters and all of the confusion surrounding different Medicare insurance plans, the Medicare supplement plans are the lettered policies. These are lettered A through N. These are standardized nationally, and the way a supplement is set up is with a larger monthly plan premium that you would pay every month, and then little to nothing out of pocket if and when you see a physician or have a medical service performed. So with so many different letters, it can be confusing, especially since there have been some changes here in the last year. So historically, Plan F, as in Frank, has been considered to be the very best Medicare supplement plan. It does come with the highest monthly plan premium, but it will cover everything from every medical service, every hospitalization, every doctor visit, etc. So there's no out-of-pocket coverage. If somebody has been eligible for Medicare prior to January 1st of 2020, they may already have a Plan F, or they would actually be eligible for a Plan F. So if somebody has had a Plan F prior to 2020, they would be grandfathered into a plan, continuing to have their Plan F going forward into 2020 and beyond. If for some reason somebody was turning 65 or becoming eligible for Medicare January 1st of 2020 or after, Plan F is no longer available. But have no fear, Plan G is here. In my opinion, Plan G, as in George, would be the next best Medicare supplement. So with the Plan G, there is still a larger monthly plan premium. It is based on your zip code, your age, and your health. So depending on where you live, those rates can adjust a bit. But with the Plan G, you would pay your premium every month. And then the only additional out of pocket is the $198 deductible, which is the Part B deductible for the year 2020, and that changes a little bit each year. So if you pay that premium, you meet your $198 deductible, nothing else is coming out of your pocket. Everything else would be covered. So Plan G can also be a great option. Please keep in mind that Part D for prescription drug coverage is not included in a Medicare supplement plan. With the Medicare supplement, it is important to keep in mind that any providers or any physicians or any facilities that you wish to be seen must be willing to accept Medicare assignment. So you can ask them directly, they'll know, they'll be able to tell you, and that way the plan will always pick up that cost. If for some reason a provider says that they will not accept Medicare assignment, you could potentially be charged what's called an excess charge, which is an additional fee or cost of up to 15% above and beyond Medicare's rate. So if you were to be charged that, Plan G would still cover you, okay? An alternative plan that is kind of the next best Medicare supplement is what we call Plan N, as in Nancy. And Plan N will come at a lower monthly plan premium than Plan G, usually $30 to $40 lower per month in a premium. And that again depends on where you live, your age, and your health. But Plan N, the only difference between Plan N and Plan G is the lower premium. And then you could potentially be charged that excess cost of up to 15% for doctor's visits and outpatient services. So depending on how often you see doctors, what your lifestyle looks like, Plan G or Plan N, either way could be very solid options. These excess charges are rare, they don't happen real often, but that's why it's so important to check with the physicians and providers that you wish to see to make sure that you won't get charged that. Plan N, you could potentially be charged that, but not with Plan G. And when you're looking across the board at the different lettered policies, really it's so important to make sure that you're comparing the coverages appropriately, because other than those two, there's not a lot of bang for your buck. So it's important to make sure that you're getting enough benefit from that premium that you're paying. Again, these plans are standardized by the carriers across the board nationally. So if you look at a Plan N with, say, Humana versus a Plan N with Blue Cross and Blue Shield, the coverage itself is going to be identical because it is standardized by the federal government. So depending on where you live, depending on the insurance carriers that are available, that difference really isn't something that you have to worry about. The biggest thing is deciding between which supplement is going to make the most sense for you, depending on how often you see your doctors and what sort of health and lifestyle that you're looking for. I realize that this is a lot of information. So if you're looking for help, if you need some additional help kind of hand-holding, walking through this process of determining which supplement makes the most sense for you, please feel free to contact me directly. I'm more than happy to answer questions and make sure that we help you find the most appropriate plan for you. Thanks so much for watching, and we'll see you next time.